day before I left LA, I went to the dermatologist and they biopsied a couple of things. And I was up here in my new condo a week and I get the phone call from the dermatologist, malignant melanoma. And so I'm like, whoa, it is a good thing that I left LA because I would have never gone to that doctor's appointment, would have never had that biopsy, and I don't know where I would be today. So my sister, of course, she gets me in to, the best doctor here at Renown. And I had surgery here in same-day surgery, and they got it all. It's all gone, but they saved my life here. So that's the reason why I volunteer here. At same-day surgery, I consider myself pretty much a runner for the nurses so that they don't have to leave their patient's side to take a wheelchair ride out, get ice, water, juice, a warm blanket, anything that I can do to help them so that they can stay with the patient. The nurses here in same-day surgery are amazing. They work so well together. They are so grateful for the help that I give them. So I'm gonna say it's the people.
I like to give it back to the community. So when I do this kind of volunteer stuff, I feel satisfied. I'm a blood donor too, so it's the same case when you donate blood. You feel good about it because when you give 1 pint of blood, I believe you save 3 lives. It's the same way when you volunteer, so I like to do it. Then I make the ER calls, like when patients come in emergency, so we have to make the calls after a couple of days to see how they are doing. Next question, we ask them like how they are feeling after their ER visit. Then we have to say if they were given a prescription and were they able to fill the prescription, and then if they had made the follow-up call with their physician and were they able to understand the discharge instructions in the ER form. It's an exposure, and it's nice when you come to volunteer. You feel at peace and it makes you feel happy.
It's kind of hard to say, that you want to be a physician without actually getting in a hospital and dealing with sick people, seeing what it's like. It's reinforced that, I want to work in a hospital and I want to be a physician, I think. Today, I'm volunteering in the general surgery unit, stocking the kitchens and the nurses' drawers with medical supplies, and really just performing whatever task the nurse would ask of me. The most rewarding day I've had as a volunteer was when I was working in the chemotherapy department of the Cancer Infusion Center. I had completely mixed up the meal orders. It was kind of a big deal at first, but the patients were still thanking me, and it was kind of weird. It goes to show, the level of help you're really offering. I can mix up all the orders and the food, and they would still thank me. So I felt that I learned a lot about how you prioritize, what's a big deal and what's not a big deal in life that day. I started volunteering to get more exposure, but as I developed my relationship here with, the staff and the patients, there's something valuable in being able to give back, I think.
We're retired, my husband and I had extra time, so I decided that volunteer was something I wanted to do, and I've been very happy since. I start my day upstairs in post-op, that same day surgery, recovery. And there's several duties that are to be tended to over there, including but not limited to sanitizing the gurneys, dressing them, make sure that they're in position for the nurse to take them immediately. Also, we do the charts. And what I mean is we don't do the charts. We clean them, we sanitize them, we prepare them and put them on the shelves. I think the satisfaction to make a difference, if in any small way, and just being able to bring that to people in need. The bonus is that this is like a family. Look at my smile.
Being a cancer survivor has been a journey that I never expected to go down. When you're diagnosed, it's a very, very scary thing. You pull something out inside of you that you didn't know that even existed. I realized I was stronger than I could ever be. It's quite a struggle. And one nice thing about me volunteering, I can help patients out when I tell them I was stage 4 and I made it. As a volunteer, I am here for the patients. When they need anything, I help out with the directions where they need to go, or if they need help with some kind of informational thing. We have a computer here that they can get on and look up their disease. A lot of times when somebody comes in and you can tell they're really, really scared, I just give them a really big hug because I know what they're feeling. When we sit down and we look at all the different wigs, we try different wigs on. I had this one lady, she came in and she just did not have a smile on her face at all. I felt so bad. When we put a wig on her, she just lit up. She just felt so good that, you know, a little bit of normal came back. If I can help some patient feel a little more relieved about what they're going to go through, that's a good day.